Hello, everybody. I am so glad to be back with another episode. Welcome to the Colorful Layers podcast. This is a space for colorful conversations to inspire a better you and me. And if you are joining for the first time, I would like to take this opportunity to just welcome you. My name is Motso Taje, and I usually try to chat to some of the world's bright minds, strong voices, and experts. And the topics that we touch on are either related to your emotional, physical, mental, and just overall well-being. So on today's episode, we are featuring a really amazing individual. And before I actually introduce her, the title is Understanding PCOS, but somehow it just broke off into two subjects. The second one being an informative guide around pap smears. So we found a way to just, marry the two and just make it make sense. In terms of my guest on this episode, she is an obstetrician and gynecologist, as well as a reproductive endocrine and infertility specialist. Her name is Dr. Lusanda Shimange-Matsose. And I have to put out a disclaimer by saying that we recorded this episode at 6 a.m. in the morning. So please do excuse the groggy voices. But I'm pretty confident that you will find the information delightful and very enlightening, because the discussion is, of course, around two important areas concerning female, reproductory health. So if you are in a rush, you can also check out the cut down versions that focus on either one of the topics. Without further ado, let's get right into it.
Morning, Lusanda. Thank you so much for waking up so early and making this happen. How are you today?
I'm great. How are you doing? And thank you for having me.
I'm good, thank you. Very excited to talk to you about this really important topic, which I think isn't spoken about enough. I don't know what your thoughts are.
I tend to agree, because I tend to do a lot of talks on the topic, and it's a thing. And I think it's important that women and men out there actually know about it, because it just makes it easier to navigate women's health and just understanding yourself or your partner, and in terms of what they're actually going through and how people can assist and when to seek help. So no, definitely very important.
Amazing. So before we start, please, can you just tell us a little bit about yourself?
Right. Okay. Where do I start? When someone asks you to talk about yourself, gosh. My name is Lusanda Shimange-Matsose, and I'm a doctor. I'm a gynecologist, reproductive endocrine and infertility specialist. And I'm all about women's health. I advocate for women's health. I advocate for women knowing their body, knowing themselves, having a healthy lifestyle, just to prolong their lives and just to live a better quality life. Do you know what I mean? Because if your health is not in check, then a lot of things actually, kind of like as a ripple effect, are also not really in order. So I talk about it a lot, and I'm all about paying it forward, in terms of whoever listens to this podcast must tell another person to say, listen, you need to go and listen to this. It is so important. So I think it's really about awareness of self and what really goes on in your body.
Let's talk about your title. I just hope I say this correctly. So you are an obstetrician and gynecologist, and you also carry the title of reproductive endocrine and infertility specialist. So layman's term, what does that even mean?
Layman's term is, I'm a gynecologist. I look after women. Right. And obstetrician means basically pregnant women, look after pregnant women. And the other bit, that is a recent thing, and that's basically a woman's reproductive health and so forth. endocrine is what we're going to be talking about today, so hormones and all that, and then infertility, those who are struggling to fall pregnant, then we assess and assist them. So it's still a part of being a gynecologist. Just in our terms, we call it a subspec, but for ease, it's more of a super speciality. So it's just something on top of my, I don't want to say basic degree because being a gynecologist is not a basic degree. But yeah, it's just another qualification on top of my being a gynecologist.
Sure. So this is like very valuable time, because if I was consulting with you, I'd be paying big money here.
You know this.
And you were quite like, I think you've always been like a forward thinker in terms of like spreading the word, because I remember when I met you quite a number of years ago, you were like, I am on YouTube. I've got a YouTube channel, and you were doing the YouTube thing. Can you tell us about it?
So yeah, you know what? So towards the end of my specialization, I was like, okay, guys, but now, when did I qualify? Was it 2015? I think it was 2015. When was it? Somewhere around there.
Yeah.
It's been quite a while. I was like, okay, fine, I'm going to be a specialist. Now what? Like, we can't be doing the same thing, like, and the comment was, I can't be doing the same thing my dad was doing then. He's also a gynecologist.
Oh, okay.
Right? And I was like, I can't be doing the same things as him. Like, guys, no, something has to change, There has to be something different. And back then, the YouTube thing was still very young in the medical space, right? In terms of South Africa. It was, in fact, the YouTube thing was it was more about, the hair bloggers and all that stuff who were doing their things, but not doctors. Doctors were not on YouTube in South Africa when I started. And then, it was around dinner and we're just brainstorming with people close to me. And then we're like, okay, guys, my first guy. It's going to be my first guy, And we're like, yes, that's what it's going to be. And I'll never forget when it launched, it was an old mutual thing that I was actually speaking at with my father. And that's when we made this big announcement. I mean, I laugh about it now, how we made it such a huge thing. But that's when my first guy, he went on social media, and what do you call it? And really the reason why I did it, the whole YouTube thing, was how do I get the message out there, not just to the person sitting in front of me that I'm consulting, but to everybody else who can't come to me, but would benefit from my knowledge, right? And we wanted to make it fun and not so serious. I mean, I don't know if you've had a chance to look at the videos, but we didn't want to make it like this very, patriarchal, thing. And that's really where it started, is that, okay, we're going to do things differently, guys. It's 2015 or 2016, whatever year it was. And we are going to rock the medical world. We are going to change things. And I remember when it started, it's not like it was embraced. Hey, I've got a lot of like bombastic side eyes, as my kids would say, kind of like, what are you doing? Like, you're a doctor. You're not supposed to be doing these things. You know what I mean? But then the rest of the rest of the fraternity caught up, kind of like, actually, this is a thing. And I think it's so important if done right, and, and why you're doing it. And for me, it was more of an educational tool and just getting the message out there to not just the person in front of me, but to everybody else. So if you are in KZN, or you're in Limpopo, or Eastern Cape, or Western Cape, wherever, you can just log on and just, watch a YouTube channel. And that's what is happening now, right? The world is so open. We've all got access to basically everything just through the net. So yeah, that's how that started. That's how my first gynae was born. And we had fun recording the videos. We haven't recorded in a long time, and hopefully that will be starting again. But yeah, so that's how it started. Hey, just getting the message out. I think for me, it's just about how do we get the message out there? There's so much that information we can give people to just prevent a lot of things later on in life. You know,
Exactly. I
yeah.
love it. And the topics, I mean, some of the content that you put out there is still quite relevant even today. And I think it will obviously remain relevant. But yeah, excited to see it coming back soon.
Thank you.
So I actually had a conversation with a colleague recently, and to my surprise, after that conversation and just speaking to other people, I was surprised to find out that there actually are women, even mothers, who outside of giving birth, they actually have never had a pap smear or even gone to see a gynae. So I'm just quite curious, is this like a common thing, especially like when you're speaking about South Africa or even in Africa?
Yeah, it is actually, and I think this is why this is so important is there are people who, I mean, there's different reasons why people have never had a pap smear, right? And I'll just mention a few. First of all, it's just access,
Mm,
just access. It's a very basic, a pap smear is such a basic um, investigation, but just getting there, just access to actually having it. So that's one of the things. The second one is, excuse me, is fear. It's fear. It's fear that, oh my gosh, I've got to go to a gynae. Oh, I'm so scared because Motso went and she had whatever experience she had, and then she tells Lusanda, and Lusanda's like, oh hell no, then I'm not going. Do you know what I mean? And not really understanding how it's going to impact on my life. And then the third one, so a third reason is people don't know that they've got to go and have one. And this is why things like this are so important. These conversations that we're having are so important, is that they don't know that they've actually got to go and have a pap smear. And when they go and have a pap smear, a lot of women don't know why they're having it. Do you know what I mean? They don't know why they're having a pap smear. So it is common. And the reason why I'm saying that, because cervical cancer is very big in Africa. Do you know what I mean? It's one of the biggest, I mean, look, we've got breast cancer, which is obviously very important and all that, but cervical cancer is very common in the African continent. It's very common amongst Black women. And the sad part about things like cervical cancer and breast cancer is that it's something that you can screen for. What do I mean? In that you can actually go and, have a pap smear, and it will tell you, okay, everything is great. Or, okay, listen, we are 5'2", getting a cancer. We need to do certain things to prevent us getting a cancer. So there's specific lesions that we look for on the results, right? Which will tell us how we should proceed forward. So you can actually prevent it. Do you know what I mean? It does not need to get to cancer stage. And that is the sad part about it. And that's why, when I hear someone has never been for a pap smear, it's like, but you need to actually go for one. But why do I need to go for one? Everything is fine. I'm like, but how do you know everything is fine? Do you know why you're going for a pap smear? And then when you start explaining it, then it's like, oh shucks. You know what I mean? And I'm like, okay, you can either go for a pap smear, have a few seconds of discomfort, or you can actually get cancer and
yeah.
and maybe die, or just your quality of life just won't be that great. You know what I mean? So yeah, it is a common thing. So when you do hear anyone saying, no, I've never been for one, you'd be like, oh, just go, don't ask questions, just go.
And I mean, obviously outside of, like the private, what do you call it? The private health or private, industry, you can actually go to a public hospital where the access is free, right?
Yeah, so you can go to just any local clinic. You don't have to go. A pap smear does not belong to private care. It belongs to every single woman of reproductive age in the world. Do you know what I mean? In South Africa, it belongs to every single woman, But I'm saying in the world, because every woman should have one, but in the context of South Africa or Africa at large, it belongs to everyone. So you can just go to a local clinic and you're just coming for a pap smear. And there's not, and it's so interesting when you say that, because when I started working in private, I'd get patients. I'll never forget my first patient. She's like, no, I'm just coming for a checkup. Mind you, I go for checkups, right? But in public hospitals, and this is the thing, but I suppose it's more at a hospital level than at a clinic level, is when patients come to us, there's already something. There's something that we must sort out. Do you know what I mean? So it's someone who's been referred to us because this is what they found. Do you know what I mean? Mm-hmm. So when I got to private, I'll never forget my one patient. He's like, no, I'm just coming here for a checkup. And I'm like, okay, what are we, in my mind, like I'm talking to myself, like, what are we checking? And that's the thing, right? She was just coming to do a checkup that everything is fine. But because my exposure for such a long time was actually dealing with pathology, right? And we always speak about preventative medicine, we must sort things out before they get to a certain point, that when someone came for preventative medicine, it was just like, I had to do a double take, kind of like, okay, why she's here. You get what I'm saying? And that is the thing, is that and I'm not saying everybody who accesses private medicine, but it's one of those where people will come just for a checkup. Do you know what I mean? So that pap smear will get done. Whereas in the public sector, the number of patients who just go for a checkup is maybe less. Look, I haven't worked in every public hospital in the country and so forth. But with that being said, and this is where our government really has it correct in terms of women's health, because it is actually a priority. It is a priority. And where they say at certain intervals, when a woman shows up to a clinic for certain things, there are certain questions that you need to ask.
Mm.
So if they say you're coming because now you've got high blood pressure and whatever, as a health worker, it's important that you ask, have you had a pap smear? If that person hasn't had a pap smear, either they make an appointment to have one, because now we're doing blood pressure clinic, we're not doing pap smear clinic, and that person must come back. So every contact that you have with a person, it must be an opportunity to do some form of health education, and that's how we can actually get it out there.
Yeah. No, definitely. And so before we actually, kick off our topic, because we're going to be talking about PCOS, I can't wait. Can we then just spend a few minutes demystifying a few things in relation to that? So is it true or false that the right age as a woman to start seeing a gynecologist is 18 or after you are sexually active?
I want to say false and true. The reason why I'm saying false and true, false in that it's when you are 18. My youngest patient is 6 years old. And that's how also my first gynae started, because girls start going through changes, right? And parents don't know how to talk to their girls about the changes that they're going through, right? So they come to me and we have a conversation, age-appropriate conversations. We don't just get in there and dive into, hey, one day you're going to start having sex and you're going to fall pregnant. No. We do age-appropriate consultations in terms of basically starting their journey as a woman from that point, so that at every interval, they know what to expect and how to deal with it. And it's actually quite exciting for me to see my young patients, when they knew nothing about a period, to now they're having their period, and now the body changes are happening and do you know what I mean? And I'm looking forward to seeing them now when they're actually over 18 and the conversations that we're going to be having. So it's false that you have to wait till 18 to see a gynecologist. I used to say when you start your period, it's a good time. And then I changed that along the way to actually even before your period, depending on your parents and so forth. So for those mothers out there who are listening and who've got young girls, it's never too early to start. It's definitely never
Love
too
that.
early. And then, in the part when you say after you're sexually active, and the reason why I said false and true is that recently I gave a talk on teenage pregnancy, right? And WHO, which we know is the World Health Organization, says an adolescent is between the ages of 10 and 19. So what am I saying is that you've got 10-year-olds who are falling pregnant.
Mm.
So that's why I said true, because if a 10-year-old is having sex, you can't wait. You should be seeing a gynecologist or a health worker, something. Do you understand? Because these girls are getting their period early and they can fall pregnant. So, and I don't want someone to say, okay, well, I'm not sexually active and I'm waiting for the right time and they're 40 and they've never seen a gynecologist. No. The sexually active part, I'm talking more in terms of these young girls who are having sex and have no knowledge of contraception or have a knowledge but limited knowledge and so forth. And that's why for me the whole my first guiding thing was so important, and that actually let's map up your female journey, your woman's health journey from the beginning. Do you know what I mean? So that when you start catching feelings and you feel like now you're ready to speak with this person, you already know that there is something called contraception. There's a lot of girls who've dodged bullets out there, excuse the pun, but in terms of they did not fall pregnant at their first sexual encounter. Do you know what I mean? Because those are the
They were
questions.
empowered with this knowledge.
Do you understand? And these are the questions I ask, because I'm anyone who's ever been in my consultation knows, like, yo, guys, she leaves no stone unturned. I talk about everything. So even with young girls, I'll say, listen, so have you had sex before? It's like, yes. I'm like, okay, when? And then they tell me when, and I'm like, okay. So were you using a condom? No. Any contraception? No. I'm like, so what was your what is your plan? And you get the shoulder shrug and everything, and it just all boils down to, how do I even start talking about, I want to have sex and I want to be on contraception, but I don't even know where to start. So they know that there is something, right? But it's that thing that it's just one time, nothing will happen. You know what I mean? And this is the thing to the parents who are listening to this, is that not talking about it does not mean it's not happening. We've got a lot of data on that. Do you know what I mean? So for that specific one, maybe I should just say false. False, false, false. Don't wait till you're over 18. Don't wait till you're sexually active. Start beforehand, so that by the time you reach that part of your life, you're prepared.
And then true or false? A consultation is highly uncomfortable. Sometimes it's painful. And then while we're at it, maybe you can just run us through like a very quick flow of what my first gynae session would look like.
Okay. So I think it depends on, it's not highly uncomfortable, and uncomfortable is very subjective in terms of, is it physically uncomfortable, or is just the consultation as a whole talking about intimate things about your life? Do you know what I mean? Such as, how many sexual partners have you had? Do you use any, like just and just talking more from a sexual health point of view. You know what I mean? Do you use condoms when you have sex? You know what I mean? How many sexual partners do you have at this current time? You know what I mean? So it's those type of, if that will make you uncomfortable from an examination point of view. And this is what I say, it's like, you just need to relax. Don't work yourself up. Yes, I mean, I'm going to be putting this instrument into your vagina. Do you know what and that is already uncomfortable. It's a very intimate examination, but it's also up to us as doctors to just make you comfortable about it. So what I do is, sometimes I'll just play music. I'm like, okay, what are we listening to today? What are we listening to? You know what I mean? And I'll play music for the patient. And, just to get their mind out of things. I'm like, okay, what can we talk about? Where's your next holiday? As I do my thing, we're just talking about the holiday, or when was your last holiday, or whatever, just to get your mind off things. So I think it's just, and the mind is such a powerful thing, and I believe in mind power. So it's just about getting the person relaxed. It's just about getting that. I hate going to the dentist. Oh my word, my dentist will actually make you laugh if she had to tell you my stories about sitting on that chair. And, but I have to literally do my breathing exercises before I go there, so it's just about don't work yourself up. Don't believe the hype, because sure, guys, we really hype each other, hey? And just also just look at why you're doing this. It's about your health.
Exactly.
And if you don't do it, what are the consequences? And that's how you must look at it. Do you know what I mean? And if you do that, then I suppose it will just make it a lot easier. So, false. But also it depends in terms of, is there actually something happening that would make the actual examination painful or uncomfortable? That's another side of it. And we know there's certain patients that come and we actually say, listen, this is going to be extremely painful. It's going to be uncomfortable. I just need you to take a deep breath and I'll be as quick as possible. But if at any point you can't handle it, you tell me and I stop. You know what I mean? So
well, thank you.
Yeah.
Thank you so much for demystifying that. Hopefully, even if it's just one other woman who will, take it upon themselves to go and see and have their pap smear done.
Yeah. So there's just a gynae consultation really, if it's just for a regular checkup. It's just a general, I always say, guys, it's a conversation with a girl. Okay, I say with a girl because I'm a female gynae, or it's a conversation with a guy. And, my consulting table in my office is actually a round table. And I always say, let's just have a round table discussion. Let's just talk. Do you know what I mean? And that is really just for ease of comfort. You know what I mean? So it's just going into history. Tell me about yourself. Why are you here? Medical history, family history. Do you smoke? Do you drink? Do you do drugs? Sexual history and so forth. And then with all that information, we just kind of like have some sort of standpoint, some sort of summary about the individual. How many times have you been pregnant? Have you had any miscarriages? Have you had any abortions? Or have you had any pregnancies that nobody knows about, but except you're going to tell me now because you're at your gynecologist? Do you know what I mean? So just having an idea. And then after that, we go into the examination. And I do at first visit, I always do a full body examination, because you discover things. You discover lumps in the breast. You discover lumps in the neck. You know what I mean? You discover a whole lot of things. Guys, our bodies talk to us, by the way, before the internal stuff. The external stuff talks to us, the doctors. And that's what we train to do, is to recognize these things. And there's just a quick examination, some few investigations. And it's really not that bad. And your period is not a reason not to go to a gynecologist. Just getting it out there while
I actually recently learned that. I was like, whoa.
Yes, we've seen it all. Yeah.
I just love how intentional you are, Lusanda, about, making your patients comfortable.
Sorry, I missed that.
I'm saying I love how intentional you are about making your patients comfortable.
Yeah, no, it's important, guys. It's a very intimate consultation, and you can see people are already stressed by going there. Like, oh, God, I've got my gynae appointment. People must be like, yay, I've got my gynae appointment.
Let's do this.
Yeah.
Okay, alrighty. So now we're going to move into our topic, which is PCOS. And I'm going to, be honest with you. This is actually a topic or a word that I only learned about this year, again, while talking to other women and, just, sharing experiences and things like that. So maybe before we get into it, I'm curious to know, what does it stand for and what is it?
So PCOS is an abbreviation for Polycystic Ovarian Syndrome, right? And basically what it is, I'm going to use a big word, endocrinopathy, and then I'm going to simplify it. So it's an endocrinopathy in women of reproductive health, with certain metabolic sequelae and so forth. So what that means is that it's a syndrome, meaning that it's got different parts to it. Syndrome is when you've got different parts that come together to give you a disease entity, right? When I say endocrinopathy, it's a lot more detailed, but just to put it simply, a lot to do with women's hormones, okay? And in terms of the sequelae, is that if not managed correctly, it's got other affectations in your life. So metabolic, affectations. So increased risk for, what do you call it? High cholesterol, diabetes, high blood pressure, also, depression, and
Oh,
what do you call it? Cancer, womb cancer. So that's why it's such an important topic to talk about, and fertility as well. So that's basically, polycystic ovarian syndrome, or PCOS, or PCOS, in a nutshell, is that it's an endocrinopathy in women of reproductive age, so women who are at the age where they can fall pregnant. So I'm not talking about your menopausal woman, I'm talking about your, premenopausal woman. And it's just got all those affectations that come with it. And it's all as a consequence of this hormone imbalance, if I can put it that way, that women have. And in your younger age group, in your teenagers, you put, there's certain things that you look for, but those you don't really diagnose a thing. You just say this person is at risk of getting it. And then when they are older, then you can say whether they have it or not. And there's certain things that we look for in order to make the diagnosis, but there's also other things that we exclude to make sure that it's not other syndromes, that it's not actually PCOS.
and I guess now the piece around, if you do have like a young girl, taking them to see the gynae early also helps in terms of, being
Exactly.
able to screen for such.
Exactly. Because then I know if I'm seeing you at the age of 13 and I see certain things, I say to the mom, listen, I want us to watch this and bring her back, in a year's time. Let's see where we at. And then I do pick, because I'll be able to gauge, okay, this is now happening. This is now happening. Okay, now this is where we at. And then we can manage that in order to prevent other things happening later on, such as having heart disease, such as getting diabetes, high cholesterol, high blood pressure, having infertility problems, that sort of thing. So extremely important.
Amazing. I think, the more I have like these conversations for the podcast, I start to realize how really like our bodies are like so, like everything is so connected, because every conversation that I have, there's always like such a big connection to just like the overall system and how some of these issues impact you.
It's so true, because and that's the whole thing, right? Your body works as just one machine. It's one machine. So when we say to people, you need to exercise, you need to have a healthy lifestyle, don't be overweight. We're not saying, and I always say this, and with your permission, I actually want to say this, on the podcast, is that doctors don't body shame, right? It may come off as that, but remember, we see the results of someone being obese. You understand? And I had a patient the other day, and she is obese, and I was talking to her, and she's like, and here we are just saying you guys are just so mean, and you only care about thin people, and now I actually see what implications my being overweight has on my life. Do you know what I mean? Because now I just like broke it down in terms of, okay, let's talk about this. You know what I mean? Let's talk about this, and you need to tell me how you feel about what I'm saying. You know. So it's all connected, guys. It's all connected. It is all connected. So these little cute kids that we see who are obese, yes, they're cute, but at some point we need to do something about it because the implications are hectic later on in life.
Yeah.
All connected.
Now, as I was like, obviously, just trying to research about this topic and how to have the conversation with you, I then read a piece that says that in women of color, they say that PCOS has been found to have higher rates of abnormal growth of hair on the body and face, insulin resistance, obesity, and other issues like high blood pressure. So is PCOS higher in women of color, or are these issues just appearing in higher rates in women of color?
So, not necessarily in women of color. So, okay, let me just speak about the hair growth thing first of all. Is that with hair growth, there are certain populations where it's normal. They are hairy women, and it may not be a result of PCOS. Does that make sense?
Yes, yes.
So, we always speak about our Mediterranean women. They generally are a hairy population, and it is normal, and that's why we'll always ask, tell me about your sisters, tell me about your mother and your grandmothers. And it's like, no, everyone is hairy. We just hairy people, and you do all the investigations, and so we call that hirsutism, right? And that's basically male. It's hair growth in the male pattern, right? But there's other causes for that, right? PCOS is one of them, but sometimes it's actually normal. So we have to look at the population that we are speaking about. And also in terms of things like insulin resistance, there are other populations where things like insulin resistance is very common, right? We know that we speak specifically like our Indian population. We know that with them, cholesterol is quite a common thing. Insulin resistance is a common thing. So it does not necessarily mean that it is PCOS. So it just depends on which population we are talking about. And if you, what I said before was with PCOS, you have to exclude other things, because if I told you Victoria Beckham had PCOS, would you believe me?
No ways.
Exactly. Do you understand what I'm saying? So it's one of those things we with PCOS, it's got different types, it's got different faces, but we have to exclude other causes of whatever's happening before we say someone has PCOS. But with that being said, when you mention the insulin resistance, the high blood pressure, and so forth, that's why we actually need to manage PCOS to prevent all these other things. So that is the sequelae of the PCOS, and that's why it's important that we pick it up early so we can manage it, so you don't get high blood pressure, you don't get hyperinsulinemia, or you don't get diabetes and high cholesterol and so forth. So it just really depends on the population that we are looking at.
So then, is there a way for me sitting at home that I can pick up the symptoms, or is it something that like only you, as an example, will be able to pick up? And if so, what do you look for? And like you're saying, like, does it vary from woman to woman?
Yeah. So basically, a simple one for women is if you're having an irregular menstrual cycle. So you're not getting your period every month. You skip here, you skip there, and you're like, whoo, at least this. And I always say this. I'm like, guys, it's good to have your period. You must have your period. Unless a doctor intentionally stops your period, don't be happy that you're not having your period. It's a good thing. You must have your period. Do you know what I mean? So a simple one for women is if you're not getting your period every month, you don't know if it's coming or going, you don't know what's happening, It comes 1 month, the next month you're like, oh, okay, I can go on my holiday, and then you're in the pool, and next thing, there's a red stream behind you. And then the next month you're like, but hold on, nothing's happening. So a regular just menstruate every month. Please, guys, just menstruate every month. And if you're not menstruating every month, you need to go and consult. Then the next one, if you are getting things like a beard or a mustache, or hair around your abdominal area, that's what we call hirsutism. So if you're getting that, also go and check it out. It could be PCOS. We're not saying it is, it could be. Go and check it out. Or you find yourself gaining weight and you can't, you're not losing it and you're struggling to lose the weight. Also, because you must keep within your weight range. But yeah, so stuff like that, go and check out. And that's why it's so important to go for those health checks, because this is what, this is when things get picked up. But like, to answer your question, is there anything that you can look out for at home? Is things like an irregular menstrual cycle, or if you are trying to fall pregnant and it's not happening, then just go and check out. It could be PCOS. I'm not saying it is, but those are things that you can look out for at home. And then everything else, just like, you need to ask. We do a full examination. We do investigations, and from that we come to some sort of conclusion as to what's happening.
And is every woman at risk of developing it, or does it have like a specific criteria?
Look, let me just say, any woman of reproductive age can get it, but not necessarily at risk. But if you've had, like, sisters, parents, or your mother who've had PCOS, and I always say not everything has a genetic link, but that history is always important. It's always important to say, look, my sister had it, so maybe, yeah. And then when we look at women who, and all those things that I mentioned in terms of obesity, the abnormal hair growth, all that stuff, those are telltale signs in that we must look out for PCOS. We must look out for other endocrinopathies that can cause this. So endocrinopathies, things to do with your hormones, that could cause this. Yeah. So it's every woman of reproductive age is at risk. And now with our diet and everything and how in our lifestyle, it's so difficult to say who's at risk or who's not. Do you know what I mean? Because now if I see an obese person, is it fair for me to say, you're at risk of having PCOS because now you're obese. But then I also can't say you're not at risk. I can't say you're not at risk. And sometimes it just could be someone has got the wrong diet and not necessarily because they've got PCOS.
Interesting. I know you mentioned quite like a few things, but like, just like to summarize, what are those health risks that are attributed to PCOS?
So I'll start from head to toe, or from outside and whatever. So with PCOS, because what happens, some of the patients have what we call clinical signs of hyperandrogenism. So meaning that they'll have acne, they'll have the hair growth, the beard, the mustache, and so forth. And the obesity, some of the patients will be obese, so the weight gain. And so that comes down to self-esteem. And with that comes down to things like sexual dysfunction. And then it comes down to depression. So there's a huge mental health component that actually goes with polycystic ovarian syndrome that we don't necessarily always look out for, but it is there, it's been described, and now with our new guidelines, it's something that we have to screen for. And with the obesity, there comes eating disorders, right? There comes eating disorders. That is also something. So your younger patients, where now, they vomit after each feed, listen to each feed, after each meal. or they don't eat because of this low self-esteem with regards to their weight. So I wanted to start with that in the beginning, that depression, mental health illness, eating disorder, sexual dysfunction all come with polycystic ovarian syndrome. Because if you don't feel good with yourself, you don't interact with people, that sort of thing. So very important. Then I want to come to the cardiovascular effect. So that increased risk of getting high cholesterol, cardiac disease, which is something that we also have to screen for, and diabetes. That's very important. So that's one of them. And then also disturbed sleep fatigue, because so there's something called obstructive sleep apnea. So because of the increased weight and things like short neck, these patients, they don't sleep well at night. So they have episodes where they stop breathing and then they get up, right? And we call that obstructive sleep apnea. So they wake up tired in the morning, because they've never had actually continuous sleep. Or they wake up with they sleep with a lot of pillows, because if they lie flat, then they can't breathe properly. And then there's the womb cancer part, where because of the imbalance of the hormones, you're at risk of getting womb cancer, right, earlier on in life than your counterparts who don't have PCOS. And then lastly is fertility problems. Patients with PCOS tend to struggle to fall pregnant. It does not mean that they can't fall pregnant. It's just a bit of a longer journey for them to fall pregnant.
Sure.
Yeah. It's a very big thing, as you can.
Yeah. It's like tons and tons of layers to it.
Extremely.
Yeah. And so, obviously when you're looking at PCOS, is there something that you can say, okay, cool, you'll pinpoint and say, this is the cause? And also, do genetics, because I know you mentioned, like, did your sister have it or your mom? Do genetics also play a role?
Genetics do play a role. When it comes to medicine, like I said, and I say this really, I suppose, carelessly so, but we can't ignore genetics, because in everything that we do when we see a patient, there's always a component of family history. There's always a component of family history that we need to interrogate. So there is an element of it in terms of is this person at risk if we see the sister had PCOS and so forth. But and there's a lot of research that goes into different parts of medicine, and we're just discovering new things every single day. It's like, sure, guys, can we discover anything else? So ultimately, if we had to really go deep and deep, there would most likely be a genetic component to most things. Then there's also a lifestyle component as well. There is a lifestyle component as well, guys. I cannot overemphasize. I mean, when I teach the students, I always say, guys, if they ask you what's your management, you must always start with lifestyle modification. At least you'll get that 1 mark. Lifestyle. And I'm not going to say, no, guys, don't go and eat fast food and, all that stuff. And it's actually healthy, guys, to cook your own food. Know what goes into what you're eating. It's really, really important. And when I was the other night, I had to go to a function, and my husband asked me, how come you haven't left? And I said, no, I'm waiting for the electricity to come back on so that I can prepare food for you guys. So for him and the boys. And so someone asked me, why did you do that? Why didn't they just get takeaway? And I'm like, but that's the thing, right? It's so much easier to just get takeaway. And then you're going to create a culture of, let's just have takeaway.
Yeah.
I mean, look, takeaway now and then, there's nothing wrong with it. Definitely. And when you've got young kids, who, they want those things, but it's about limitations at the end of the day. So lifestyle. So important. So important. So those are the things I always look at. Family history, lifestyle, and then obviously there's the own patient's makeup, clinical makeup that we can say, okay, this puts someone at risk.
And so once you've been diagnosed, so you've gone through the journey of looking at the symptoms, you obviously go in, you get checked in, and you get diagnosed. What are the treatment options that you often offer to patients?
So I always ask, okay, so let's just say it's someone with the abnormal hair growth, or because patients with PCOS will come for different things, right? So it could be someone, let's just say now, who's struggling to fall pregnant, and then they come and see me, and I was like, okay, this is why you're struggling to fall pregnant. It's because actually you've got PCOS, so this is what we are going to do. Do you understand? So then we employ strategies to help them fall pregnant. So the fact that they've got a beard and all that stuff is not a bother to them. It's like, nah, I'm good. I shave every day. Does not bother me. Do you know what I mean? But the fact that I'm not getting pregnant bothers me. Then we deal with that. But if they come in and they're like, no, I don't want to have a child right now, but actually this hair thing really bothers me, then we employ those strategies for the hair situation, right? But with that being said, I make a note to say, okay, this person's got PCOS. Right now, their aim is that they just want to fall pregnant. But I'm well aware that there is abnormal hair growth, and I've screened for cardiovascular disease. I've screened for diabetes, cholesterol, and all that stuff. So these are the things that we're going to also manage going forward. So it's not just a matter of, okay, fine, you're pregnant, go away. No, then we have basically a map of their journey in terms of being diagnosed with PCOS. And then you screen for the things like depression. If it's a person with PCOS and they're overweight, then you institute lifestyle modification, exercise, your dietitian or nutritionist, and we know them now, that sort of thing. If I pick up, no, actually this person, they got diabetes, then we manage that. So it's all different strategies for a certain complaint that a patient will have. But we always bear in mind that it does have its sequelae, and we need to be aware of that, and we need to manage that before it actually happens. So education is a big part of it, making the person understand what does it mean to have PCOS, what implications does it have on their lives besides the fertility, because once you have your kids, it's not okay to say, oh, at least I've got my kids. Next thing you have a heart attack. Yeah, next thing you have a heart attack, and then you can't look after your kids.
Oh my God.
Do you understand?
Yeah.
And, so those are the conversations we actually have in terms of when patients are diagnosed. So any diagnosis you have, though, not just PCOS, is what implications does it have on my life, and how do I manage it?
Sure. And so once somebody gets diagnosed with PCOS, as you were saying, like, lifestyle changes and so on, is there a cure? Is there a way that they can cure this, or is this going to be something now for the rest of your life you have to manage?
It's something that you have to manage for the rest of your life. But with that being said, if let's just say it's someone with PCOS and they're obese, right? And now they go and lose a lot of weight. They go on this whole health mission and so forth. Then you are putting yourself less at risk of certain things. Do you understand? So in terms of, because it's all about the physiology and how the body works. And that's when I say, like, everything is connected. So you find that now you lose 10 kg. We always say if you lose 10% of your body weight, already that has far-reaching, positive implication. And that then you put in, there's less risk of getting diabetes, high cholesterol, your obstructive sleep apnea that I spoke about, your cardiovascular disease, your high blood pressure. You understand? So it's something that I don't want to say cured, because at the end of the day, you'll always be, even if you lose all that weight, you'll always be at risk, right? But it's something that can really be properly managed if it's picked up and the patient actually listens and understands what's going on with it. Yeah, it can definitely be managed. And I mean, we hear those stories where someone was diabetic and then they went on, they started eating well, they started exercising.
Yeah.
And, they lost weight. Now the lean body mass is, great. And then they're no longer diabetic and then they're off their medication. So it's not to say that if you've got PCOS, you need to be popping pills for the rest of your life. No, definitely not. Definitely not. With the right plan, you can live a good life.
Heal your body.
And heal your body from inside out.
I love that. And so, I mean, like what I'm getting from you is that lifestyle really plays a big role. And I think you've touched on like a lot of those elements. But is there something like in particular where you can say, as women, these are the 2 things or 3 things that we need to prioritize in order to, decrease our chances of being at risk for developing it?
So, I think my parting message for that would be awareness. Be aware of your body. Be aware. Know thy body. Know thy body, and it's so important. So, like I mentioned the menstruation already. If you are not getting your period every month, that is already a thing. And then obviously, like I've been going on about lifestyle, is that unhealthy lifestyle, extreme weight gain, and so forth. You are not doing yourself a favor. So those are things that can be managed. We always speak about modifiable and non-modifiable factors. So your non-modifiable, I'm 43, I can't do anything about it. Do you know what I mean? I really can't do anything about it. I may go for Botox and do all those things, but ultimately my body is 43 years old. Right. But modifiable, if I start now eating takeaways every night and I start gaining weight and so forth, I can do something about that. If I'm a smoker and I drink and I do drive, I can do something about that. Do you understand? I can't do anything about my genetics. My genes are my genes. So anything that can be modified is already a step in the right direction. And those modifications for me is always lifestyle. It's always lifestyle. And yeah, so that is the one thing. So lifestyle and awareness, knowing your body, that's very important.
And I guess like, in this world that we live in, like it becomes so hard to actually do that because, we're sitting at our desks, the food, it's easily accessible, the takeaways. There's a lot of like, chemicals and hormones, and it's hard to get moving. So it actually becomes really like you have to be intentional about wanting to improve your life.
I actually wanted to say that it's so easy to make excuses about you're sitting on your desk and the food is accessible and it is so easy. And that's the thing. If it's easy, then ask yourself, is it right? If it's easy, is it right? Is it easy to wake up in the morning and go to, I read one of my colleagues tweeted about something yesterday. It's like, guys, people who convince themselves that exercising is great. I don't know. It's hard. He says those people are delulu. And I know exactly what you're saying. It's like, yes, but once you've completed the exercise, you feel great and so forth. You're releasing the endorphins and everything. But while you're doing it, it's actually painful. But it's the result of that is important. Do you understand? So what I'm getting at is that if it's easy to just quickly go and get, I don't know, the wrap that was made by whoever and so forth, or it's just easy to order food in and it gets delivered, like I don't have those apps. I don't have any of those delivery apps because I realized, no, because guys, you just go on there, you check what you want, and then it gets delivered. You're not even looking at delivery fees and all that stuff. You know what I mean? It is easy, but you have to be intentional. If you're intentional about having a good, we always speak about quality of life, then you will do it. Then you will do it.
And I
It's
mean,
as simple as that. It's easy. I always say to patients, because they'll say, no, doc, no, I eat very healthy. I mean, I have my jungle oats in the morning, and I'm like, okay, great. And then what do you have? I have my coffee. Tell me about your coffee. No, milk, 3 teaspoons of sugar. I'm like, can we just stop at the 3 teaspoons of sugar? I'm like, so how many coffees do you drink in a day? It's like, no, I'm always like going to the coffee station. I'm like, so you go, 5 times in your work day? It's like, yeah, maybe sometimes even 6, 7. And I'm like, with each cup of coffee, having 3 teaspoons of sugar. And I'm like, so do you feel that's healthy?
yeah.
And
Yeah.
do you understand? So when you start dissecting stuff, then you realize that we are not as healthy as we think we are.
True.
True. I'm the first person to put up my hand and say, I've got no issues with food. But I can also tell you that I've got a packet of jelly juice in the cubby hole of my car. I've got a packet of jelly juice in the cubby hole of my car. And the other day I was stuck in traffic and I was so hungry. And I was like, but I've got my jelly juice. Do you understand?
Yeah.
And there's nothing healthy about that. Not to say that you can't have those things. So yes, sometimes the stuff that is easy for us to get is actually the stuff that is not necessarily good for us.
And I think what I appreciate about this conversation with you, Lusanda, is that I think in my experience or seeing, many doctors will plow you with, let's say, medication, and it's very rare that you have the conversation to say that, you need to dissect your lifestyle. What are you eating? Are you moving? And all those things, And often when I speak to some of my friends, because we're like now in our 30s, we think things are moving a little slower in terms of so you want quick and easy solutions to try and bring down the weight, where it actually comes down to your habits, right?
100%. I mean, sure, guys, I can tell you now, we don't always want patients to be popping pills, right? We don't. But sometimes you realize that, okay, but guys, if I don't do this, if I don't institute a certain management, something can happen. Something very grave can happen. Do you understand? So, but patients need to play their part as well. I always, one of the things that we do with Polycystic Ovary Syndrome is we do put patients on the pill. We do put patients on the pill. For a hormone imbalance, we're going to give you hormones to sort it out. But also we know that actually if you lost, weight and all that stuff, we don't have to put you on the pill. Do you know what I mean? We don't have to. So it just really all boils down to that, guys. Easy fixes are not a good thing. So you wanted to say?
Oh, sorry. I was saying, any last words from you as we wrap?
I think, first of all, thank you for inviting me.
No, thank you.
The podcast. I feel very privileged. And for me, any opportunity to talk about, such important topics, especially pertaining to women's health, is so important. And just for allowing me to actually, the time and the detail, and the questions, the important questions that you are asking. And I think just as a parting shot is just, as women, we need to know ourselves. We need to talk about what we are going through, because you may find that, in fact, not you may find, you will find that you are not the only one. You are not the only one. And by talking about it, you are creating awareness for the next person, and I just look after yourself and know yourself. And go for that pap smear if you haven't had one. Or go for it if you do, Yeah, but it's all good. It's all good. I have hope. I have hope because a lot more people are speaking, and there's a lot more awareness campaigns that are happening. And like you said, we spoke about the YouTube videos. You just go and Google and it's there, but verify your information with a qualified medical practitioner. We know what's been going on at the moment out there with doctors and so forth. So just qualify your information or validate your information with a qualified health professional.
Yeah.
And then, everything else you'll see will just fall into place. It will all fall into place, guys. I have not lost hope.
A big thank you to my incredible guest, Lusanda. I would like to encourage you to check out her YouTube page. It's titled My First Gynae. I'm not sure if by the time this goes out, if she will have new content, but the content that she currently has is still super relevant. And you can also find her on Instagram, going by the handle of @IamLadyLui, spelled IamLadyLui. And then, of course, a big thank you to you. Your support is very much appreciated. Please don't also forget to hit that follow or subscribe button depending on what medium you are listening on. And you are welcome to go the extra mile by showing us some extra love by liking the content. If you would like to chat about collaborating with us on the podcast, drop us an email, colorfullayerspodcast@gmail.com. From me, Motso Taje, cheers for now.